Perform hand hygiene with soap and water. Gather necessary supplies: a tray, a pus pan, a watch with a second hand, an eardrum thermometer, an aneroid blood pressure meter, or sphygmomanometer, a stethoscope, a hand sanitizer, and an alcohol swab. Wipe the earpieces and valve of the stethoscope with an alcohol swab. Check if the supplies are working. Approach the patient with items and introduce yourself.
안녕하세요. 저는 담당 간호사 김간호입니다.
Perform hand hygiene with hand sanitizer. Identify your patient with 2 steps. First, ask your patient name with open-ended question. Second, compare patient's medical ID wristbands with patient's list.
정확한 환자 확인을 위해 환자분의 성함, 생년월일, 등록번호를 확인하겠습니다. 환자분 성함과 생년월일이 어떻게 되세요?
김경북 780410.
등록번호는 제가 2번 팔찌로 확인하겠습니다.
Explain the purpose and procedure of measuring body temperature, pulse, respiratory rate, and blood pressure to the patient.
오늘 검사 예정으로 체온, 맥박, 호흡, 혈압을 측정하겠습니다. 체온은 고막에서 측정하겠습니다.
네.
Take the probe cover out of the container and place it on the eardrum thermometer.
귀 속에 체온계를 넣겠습니다. 고개를 조금 돌리겠습니다.
네.
After turning the patient's head to one side to expose the ears that measure body temperature, in the case of adults, pull the auricle backward and downward, and gently insert the probe into the external auditory meatus to measure body temperature. Remove the probe cover and place the thermometer in the container. Lower the patient's blanket so that you can visualize their chest.
누운 상태로 편안히 있으시고 정확한 측정을 위해 이불을 내리겠습니다.
네.
Place your finger on the radial area, check the pulse area, measure the pulse rate, and evaluate rhythm and intensity. Measure the patient's pulse rate for a full minute if this is the patient's first admission or if the pulse rhythm is irregular. If their heart rhythm has been regular during their hospital stay, measure the patient's pulse rate for 30 seconds and multiply by 2. After measuring the pulse, measure the respiratory rate so that the patient doesn't notice it while placing his hand on the artery and evaluating the breathing pattern. If the patient is hospitalized for the first time, measure the patient's respiratory rate for 1 minute. If their respiratory rate has been regular during their hospital stay, measure the patient's respiratory rate for 30 seconds and multiply by 2. Take note of the measured pulse, breathing, and body temperature.
호흡, 맥박, 체온 모두 정상 범위입니다. 이불을 정리해 드리겠습니다. 이번에는 혈압을 측정하겠습니다. 혈압 측정하는 동안엔 말씀하시면 안 되십니다.
After the patient takes a comfortable position, adjust the patient's arm to the same height as the heart and expose their arm. Ensure that the pressure tube connected to the cuff bulb is parallel to the brachial artery and wrap the blood pressure cuff 2 to 3 centimeters above the brachial artery. Make sure there is just enough space for one finger. If this is not the first time to measure blood pressure, look for the brachial artery, place a stethoscope on it, and stabilize the bell with your hand.
제가 혈압 측정을 위해 공기를 주입하면 팔이 조금 당기는 느낌이 날 수 있습니다. 압력은 금방 감소되니까 걱정 안 하셔도 됩니다.
네.
Close the control valve of the blood pressure gauge and pump the pressure bulb to infuse air to the cuff so that the scale of the blood pressure gauge rises between 160 to 200 millimeters of mercury. Slowly open the adjuster valve and lower the scale by 2 millimeters of mercury per second, and remember the scale at the first point where you hear the sound. Remember reading the scale where the sound disappears. Open the control valve completely, let air out of the cuff, release the cuff, and set up a blood pressure gauge.
측정이 완료되었습니다. 혈압도 정상 범위입니다. 환히 정리해드리겠습니다.
Assist patient with their gown. Take a note of the measured blood pressure. Wipe the earpieces and valve of the stethoscope with an alcohol swab. Perform hand hygiene with soap and water. The next section will show how to measure initial blood pressure. If this is your first time measuring blood pressure, use your pulse to check the systolic pressure. With one hand, lock the regulating valve of the blood pressure gauge, press the pressure valve to pump air into the cuff, and place your fingers on the brachial artery or radial artery. Touch the brachial artery or radial artery and raise the scale of the blood pressure meter further by about 30 millimeters of mercury at the point where the pulse disappears. Read and remember the scale of the point where the pulse in the brachial artery or radial artery is touched again while slowly opening the valve and lowering the scale at a rate of 2 millimeters of mercury per second. Wait at least 15 seconds after completely deflating the cuff.
혈압을 정확하게 측정하기 위해서 압력을 얼마나 넣어야 할지 확인하였습니다. 잠시 쉬었다가 다시 측정하겠습니다.
네.
After a while, wrap the cuff 2 to 3 centimeters above the brachial artery. Fix the stethoscope on the brachial artery without moving it. Close the control valve of the blood pressure gauge and press the pressure bulb to measure the blood pressure by raising the scale of the blood pressure gauge 30 millimeters of mercury higher than the systolic pressure checked by the pulse. Perform hand hygiene with soap and water. Document blood pressure, pulse, respiratory rate, and body temperature on the nursing record.